And we are here once again with Mr. Mejia from the County of Sonoma. And again, we are now seeing you about twice a month instead of every week, as we were doing for a while, because everything is changing. The number of cases in general is not as high as it used to be, but at the same time, we always want to be updated as to any changes that are happening. So thank you for being here with us. And what information do you have for us today?
Well, I have good news. We continue to expand our base of immunity. As of today, we have surpassed the 1,043,000 doses of vaccine applied here in the county. The exact number is 1,043,389 doses that has been applied for residents of the county 5 years and older. We have hit another landmark, which is 82% of the county's eligible population fully vaccinated, with an additional 7% partially vaccinated. That's 89%, the vast majority of the county with at least one dose. 11% remains non-vaccinated. And we continue making progress with boosters as 65.2% of the population in the county that is eligible has a booster. The second boosters are moving slowly in general terms, but really fast in the group 65 and older that are the most vulnerable and that are wise enough to protect themselves. Good for them. We're making a strong recommendation for those persons that have an immunocompromised system to get their second booster, which is available widely throughout the county, through your doctor or through pharmacies. So get your booster if you may. We are seeing also that the numbers are slightly going, there's an uptake in them as it was expected, since we are doing all of this removing protections that we have during the pandemic as the numbers go low. But now it's a light uptake. Our rate for new daily cases is 11 for every 100,000, and our case rate for unvaccinated persons is 20.1 per every 100,000 compared with the 8.6 for vaccinated residents. Our overall testing positivity rate is 4.3%. Last week we were around 2%. Our equity metric testing positivity rate is 3.4%. There is a new, it's called Test to Treat Toolkit. And that's an announcement made by the California Department of Public Health that has put out a toolkit on COVID-19 treatment options, including new test to treat locations. There are several COVID-19 treatment options available in the United States that can help keep COVID patients out of the hospital. Treatments work best given as soon as possible after testing positive and developing symptoms. There are two ways to get outpatient COVID-19 treatments. The first one is to talk to your healthcare provider to learn if you qualify for a COVID-19 treatment that requires a prescription or a referral. And the second way is find test to treat locations that offer COVID-19 testing and prescriptions for oral antiviral pills at one location. We ask people to learn more about these treatments and how to get them going to our website. I'm going to mention the link. I'm going to go slowly. I ask people to go back to your video, and I put the link in your chat also to have it on your website. The link is B as in boy, bit.ly/CA COVID treatment. Again, bit.ly/CA COVID treatment.
And for anyone who has Facebook, you can go to my Facebook page, DACA Sonoma County, and I just posted that information as we are speaking here live. So you can go and check it out after we are done with this radio interview.
Fantastic. Thank you, Rafael. There is also more news. The statewide student vaccine mandate is delayed. California will not require students to be vaccinated against COVID-19 for at least another school year. The earliest the requirement would go into effect now is on July 1st, 2023, pending full approval by the Food and Drug Administration of a COVID-19 vaccine for children under 16 years old. The state is delaying implementation of the mandate for the 2022-23 school year to ensure sufficient time for successful implementation of the new vaccine requirements according to the CDPH. Then also there is another news that the mask mandate for public transit ends. A federal judge in Florida this week ruled that the Centers for Disease and Control and Prevention mask mandate for air travel and public transit was invalid, ending the requirement nationwide. The Justice Department is considering appealing the ruling if the CDC feels that the mask mandate is necessary to protect public health. Health officials still recommend wearing a face covering while using public transit and on airplanes, now that mask wearing is optional. Finally, the local hospitalizations and death, we're seeing an uptake there too. There are 17 COVID-related hospitalizations in the county as of Monday. 4 of those COVID patients are in ICU beds. And the number of deaths in the county have increased to 489 departures because of COVID-related deaths since the pandemic began. And that's my report for today.
Definitely. And again, there's a lot of information there. It's a lot of things to celebrate that includes the number of people who are getting vaccinated. We need to continue that process and that progress that has been done, really. And also, again, we invite the community to not judge individuals who choose to wear masks, even though there is no mandate at the moment, because, you know, we are seeing it and we're hearing it, that people get rude comments about wearing a mask indoors. But again, we don't know if that person is, you know, has a specific illness that that they're, you know, trying to prevent COVID, or 2, they may be taking care of somebody else at home that has, you know, difficulty with a specific illness, like the ones that you mentioned on diabetes or heart problems or obesity, whatever the situation may be. Let's be respectful, right? You don't want anybody to tell you about not wearing a mask. You know, let's leave people alone, because I'm hearing a lot of those negative comments around town. And so with that, I appreciate the time that you always dedicate to us. I look forward to our next dialogue. Again, we are doing it every other week. But again, we try to make the space available as much as possible for you. And with that, I want to thank you, as always, for taking the time and being with us.
I appreciate your opening the doors for the county to bring this news. In a sense, it's good that we have less news about COVID, because it means that we're moving in the right direction, as we have stated today. But if something change, I will be asking you to welcome me more oftentimes as we used to. But you know, we all went out of this pandemic, and hopefully we get there soon.
Definitely. Thank you for your time, and I look forward to our next check-in.
I will do. Have a nice weekend.
You too. Bye-bye.
Thank you. Bye.